Your kidneys may be losing function right now, and you feel completely fine. That is not a scare tactic. That is just how this works. Blood sugar damage to the kidneys is silent. It is slow. And by the time most people find out, things have already moved further than anyone would have liked. I'm Grace Wells, kidney and diabetes health educator for older adults. And today we are going to talk about something that does not get nearly enough attention, especially for people over 60. Because here is the situation. A lot of older adults across the US, Canada, the UK, and Australia are managing blood sugar right now. Some have a type 2 diabetes diagnosis, some have been told they are pre-diabetic, and some have never been given a label at all. But their numbers are quietly running higher than they should be. In most cases, they feel fine, no pain, no obvious symptoms. Life goes on. But inside the kidneys, something is happening, something small, something that adds up. Stay with me today, because what I am going to explain does not require a medical degree. It just requires understanding how your body works and knowing the right questions to ask your doctor, especially that last one, because the test that could protect your kidneys is one many older adults have never been told to ask for. Your kidneys are not just waste filters. They are extraordinarily precise instruments. Inside each kidney, there are roughly 1 million tiny filtering units called nephrons. And inside each nephron, there is a microscopic ball of blood vessels, the glomerulus. These are the filters within the filters, incredibly small, incredibly sensitive. Every single minute, your kidneys filter about a liter of blood. Nutrients stay. Waste goes. Blood pressure is regulated. It is a continuous, non-stop job. Now here is where blood sugar enters the picture. When blood sugar runs consistently higher than normal, not always dramatically high, just persistently elevated, it puts those tiny blood vessels under pressure. Over time, the walls of those vessels thicken. They become less flexible. Filtration becomes less precise. And once those microscopic filters start to change, the kidney goes into overdrive, trying to compensate. It actually overfilters for a while. And most people feel absolutely nothing during this phase. That is what makes this so dangerous for older adults specifically. By the time the kidneys can no longer compensate, years of damage may have already occurred, without a single symptom. This does not mean panic, it means pay attention. Now I want to tell you about something called microalbuminuria. It sounds complicated, it is not. Normally, a protein called albumin stays in your blood where it belongs. It should not leak into your urine. But when those tiny kidney filters start to get damaged from high blood sugar, they become leaky. And one of the first things that leaks through is small amounts of albumin. This is called microalbuminuria, and it is one of the earliest signs that kidney damage from blood sugar is beginning. Here is why this matters so much. It can show up in a urine test before your kidney function number, called eGFR, has dropped at all. Before you feel anything, before anyone would even suspect a problem. That means a simple urine test can catch this early, really early. And early is when you have the most options. So if you are over 60, if your blood sugar has been on the higher side, if you have been told you have prediabetes or type 2 diabetes, ask your doctor about this test. It is called a urine albumin to creatinine ratio, or UACR. It is routine, not invasive, and it can tell you something important that your other lab results may not yet be showing. Now let's add another layer, because blood sugar does not work alone. High blood sugar and high blood pressure are a team, and when both are elevated at the same time, they do not simply add their damage together. They multiply it. High blood sugar already stresses those tiny kidney filters. Now add the constant pressure of elevated blood pressure hitting those same vessels with every heartbeat, every minute, every day. The combination accelerates kidney damage significantly. And for older adults, this combination is extremely common. If your doctor has prescribed a blood pressure medication, particularly a class called ACE inhibitors, or ARBs, Those medications often do double duty. They protect your heart and they protect the kidney filters directly. Do not stop or change any blood pressure medication on your own. But understanding why you are taking it matters, because that understanding is what keeps you consistent, and consistency is what keeps those kidney filters protected. If you are not sure whether your blood pressure medication is also protecting your kidneys, that is worth asking at your next visit. Your doctor will be glad you asked. If this is the kind of clear, practical kidney health information you have been wishing someone would explain, you may want to stay with this channel. There is more where this came from. Now I want to talk about aging itself, because over 60, your kidneys are already facing something that has nothing to do with blood sugar. Kidney function naturally declines with age. Starting around your mid-30s, it begins a slow, gradual decline over the decades. By the time most people are in their 60s or 70s, the kidneys are working at roughly 70 to 80% of what they could do at 30. That is normal. That is not a disease. But here is the problem. When blood sugar damage is added on top of natural aging, the kidney has less reserve, less ability to compensate, less ability to recover. What might be manageable damage in a 40-year-old becomes more significant at 70. This is why this matters more as we get older, not less. And why catching things early, while there is still good function to protect, is so much more valuable than waiting. Because by the time symptoms appear, fatigue, leg swelling, changes in urination, significant damage has often already occurred. Symptoms are late signs, not early ones. The early warning signs are in your lab work, not in how you feel. So what do you actually ask your doctor? Let me be specific, because I think this is where a lot of older adults feel uncertain. First, eGFR, estimated glomerular filtration rate. It is calculated from your creatinine blood test and tells you how well your kidneys are filtering. Most doctors check this regularly, but it is worth asking, what is my eGFR and has it changed since last year? Second, UACR. That urine albumin test we discussed. This is the one that catches early damage before the eGFR changes. Not everyone gets this routinely. If you have elevated blood sugar and you have not had this test recently, ask for it by name. Third, HbA1c. This is your 3-month blood sugar average. A single fasting glucose reading on a single day does not always show the full picture. HbA1c shows what your blood sugar has been doing consistently over time. That is the number that matters for kidney risk. Fourth, blood pressure at home, not just at the clinic. Many older adults experience higher blood pressure in a doctor's office simply from the stress of the visit. The reverse can also happen. Some people read perfectly calm at the clinic but run higher throughout their actual day. If you have a blood pressure cuff at home, use it consistently. Same time each morning, sitting calmly. Bring those readings to your doctor. Those numbers tell a more complete story than one measurement in a clinic. Now the habits. And I want to be realistic here, not a list of overwhelming changes, just the ones that genuinely move the needle. Walking. A 20 to 30 minute walk most days improves insulin sensitivity, which means your body uses blood sugar more efficiently. It also supports blood pressure management. No gym required, no special equipment. If joint issues make longer walks difficult, even 10 minutes twice a day adds up. Consistency matters far more than intensity. Hydration. Mild chronic dehydration puts additional stress on the kidneys. Most older adults do not drink enough water throughout the day. Staying well hydrated helps the kidneys do their job. However, if your doctor has told you to limit fluids because of heart failure or kidney disease, follow that guidance. Fluid needs vary. When in doubt, ask. Sodium. This one connects directly to blood pressure. Sodium does not damage kidneys directly, but it raises blood pressure, which stresses the kidney filters. And most of the sodium in our diets does not come from the salt shaker. It comes from packaged foods, bread, soup, canned goods, condiments, and restaurant meals. The habit I would suggest is simple. Start reading labels on the things you eat most often. You do not need to eliminate anything dramatically. Just become aware. Because awareness leads to choices. Your comment might help someone else. If anything in this video has made you think of a test you have not had or a question you have never thought to ask, leaving a comment below may do more good than you realize. Others are reading those comments. Others are dealing with the same things in silence. And medication consistency. This is the one I think gets underestimated the most. If you have been prescribed medication for blood sugar or blood pressure, consistency matters enormously. Missing doses, skipping days, these are not small things when it comes to kidney protection. I understand managing multiple medications is complicated. Side effects make it harder, and it is easy to deprioritize something when you feel fine. But these medications are not treating how you feel right now. They are protecting what you cannot see, reducing the daily pressure on those tiny kidney filters, even on the days when everything seems normal. If you are struggling with your medication routine, cost, side effects, confusion, that is a conversation worth having with your doctor or pharmacist. There may be adjustments available. But stopping without guidance is the one thing that can accelerate the very damage we are trying to slow. One more thing before we wrap up, and this one surprises people. You may have heard that potassium-rich foods, bananas, potatoes, beans, leafy greens, are something kidney patients need to avoid. And for some people at advanced stages of kidney disease, that is true. But for most older adults whose kidneys are still working reasonably well, these foods are not a problem. In fact, potassium supports heart and blood pressure health for most people. The key phrase there is depending on your kidney function, because once the kidneys decline to a certain point, they can struggle to clear potassium from the blood, and elevated potassium levels can cause serious heart complications. This is why dietary recommendations for kidney health are not one size fits all. What is right for you depends on your eGFR, your lab results, and your doctor's guidance. Do not restrict your diet based on fear alone. Restrict it, if needed, based on your own numbers. And that keeps coming back to the same point. Know your numbers. Let me bring this together. High blood sugar damages the microscopic filters inside your kidneys, silently, over years, without symptoms. The first detectable sign is often albumin leaking into the urine, which a simple UACR test can catch early. High blood pressure makes the damage worse, and the two together are significantly more dangerous than either alone. And because kidney function naturally declines with age, older adults have less reserve to absorb that damage. None of this means your kidneys are in trouble right now. For many people watching this information is arriving before anything serious has happened. That is exactly the right time to have it. So here are 2 things you can do before your next appointment. Write down these 2 questions and bring them with you. First, what is my current eGFR and has it changed? Second, have I had a UACR test to check for albumin in my urine? 2 questions. That is it. If you also have a blood pressure cuff, take readings for 3 mornings in a row and bring those numbers too. That small preparation could make your next appointment the most useful one you have had in years. This content is for educational purposes only. It is not a substitute for personal medical advice, diagnosis, or treatment. Please work with your own doctor before making any changes to your medications, diet, or health routine. Lab values and recommendations vary from person to person. Before you go, I want to ask you something I genuinely want to know. Do you check your blood sugar, your blood pressure, or both? And how regularly? Because so many older adults are managing one or the other, often quietly, often without much clear guidance. And hearing that others are doing the same, tracking, asking questions, staying on top of it, matters more than people realize. If even one question in this video helps you walk into your next doctor's appointment feeling clearer and more prepared, then this video did exactly what it was meant to do. And if this is the kind of honest kidney health guidance you wish someone had explained to you sooner, I think you will want to stay with this channel. These videos are made with you in mind, every single one. Take care of those kidneys. They have been working hard for a long time.